New York governor explains how she will replace 70,000 experienced unvaccinated hospital workers who she is threatening to fire at midnight. So we've been covering this. There's been a lot of healthcare worker shortages. Is today Tuesday?
Yes.
So I was on a private show. So we covered yesterday on a private stream about how a healthcare provider who takes care of 900 sick kids at home is afraid that with the vaccine mandate, they're not going to be able to take care of their kids. They're not going to be able to meet the patient's needs. And now here, she's going to replace 70,000 experienced unvaccinated hospital workers. This seems crazy.
How's this carrying?
But here we go.
And we'll be nation leading with our mandate, which strikes at midnight tonight when everyone is expected in a hospital in the state of New York or a healthcare facility to have been vaccinated. I will be signing an executive order to give me the emergency powers necessary to address these shortages where they occur. That's going to allow me to deploy the National Guard who are medically trained, deploy people who've been retired who may have had a license lapse, bring in people from elsewhere.
Retired.
So we're going to bring in retired people whose licenses have lapsed. So we're literally going to put people out on the street. We're going to take away their livelihood. And that seems like a crazy number. Could this possibly be true? 70,000? Could that possibly be true, Max? Is that real?
It's absolutely true. And we've already seen the mandates prevent students from getting to school because of the amount of school bus drivers who are being fired. Now we see Kathy Hochul, Andrew Cuomo's replacement, literally waging war on the working class. She's bringing in the military to replace them or threatening to do so. And 70,000, I mean, that's not an implausible number. There's no consideration for the cost on the public health care system here. I mean, not that we really have public health care, but it's not considered. The only thing that's considered is one thing, which is meeting these fantastical goals of vaccine uptake. The lives of these people, these workers, are not considered, whether they will go hungry in a tight job market. And this is the perfect method. This is the perfect mechanism for intimidating workers when you have such a tight job market. I spoke to a construction worker in Midtown New York yesterday. He actually approached me on the street because he'd seen me on your show and he wanted to talk about this very issue. And he said that he felt intimidated into taking the jab. He feels like his constitutional rights are being violated, his bodily autonomy is being violated, but he did not want to go hungry going into the winter, and that many of his colleagues feel the same way. And I've heard this from people all across the spectrum in different fields. I just got off the phone with Garrett Ramirez, who is a 9th grade public school teacher in New York City, a member of the Teachers Union, very active member of the Teachers Union, and a leader of Teachers for Choice that has been fighting these mandates. And he told me that 20,000 Department of Education workers could be thrown out of work. There are currently about 36,000 who have not taken the jab, and that's the estimated number who will be thrown out of work. He said thousands of licensed teachers will be thrown out. How they'll be replaced is anybody's guess. What this will do to public education in New York is obvious. It will do grievous harm. And the fact is, there are some parents who don't actually want their children to go back to in-person learning because they're so freaked out about COVID. And there are far more powerful forces that want to essentially eliminate or weaken in-person learning and undermine teachers' unions. Chief among them, Bill Gates, who collaborated with Andrew Cuomo on the Reimagine Education initiative, which emphasizes a great profit center for big tech, which is remote learning. So that's where we're heading. We're heading towards a gigantic attack on the working class, mass firings, and very little resistance to this from the sectors that we would normally associate with being pro-worker, including the organized left in the United States. I mean, this is the program that Jacobin Magazine, the semi-official journal of the hyper-obedient lockdown left, has endorsed in full-throated fashion. So they're endorsing tens of thousands of teachers, hospital workers who worked on the front lines of the pandemic for the last 18 months. being thrown out of work. It's a very demoralizing situation from the inside. What's being described to me is really depressing. And honestly, if you had asked me if this would be happening a year ago, I would have said you're a crazy conspiracist, but here we are.
So I just want to get into it. New York hospitals on Monday began firing or suspending healthcare workers for defying a state order to get the COVID-19 vaccine, and resulting staff shortages prompted some hospitals to postpone elective surgeries or curtail services. So that's what we've decided to do in the United States. Is we're going to fire healthcare workers in the middle of a friggin' pandemic when health hospitals are understaffed to begin with, because half of them are being staffed by equity firms. This is crazy what we're doing. This is nuts. And this is at the behest of Big Pharma. Show me where the science is on this. Show me where the science is on this. Erie County Medical Center in Buffalo suspended elective inpatient surgeries and had stopped accepting intensive care patients from other hospitals as it prepares to fire hundreds of unvaccinated employees. I'm going to Buffalo in just a few weeks. Maybe I could swing by the Erie County Medical Center, see how they're doing with all their fired employees. The inoculation push comes as President Joe Biden and other state and federal political leaders ratchet up pressure on unvaccinated Americans, some of whom object to mandates on religious or health grounds. New York's health department issued an order last month mandating that all healthcare workers receive at least their first COVID-19 shot by September 27, triggering a rush by hospitals to get their employees inoculated. New York Governor Kathy Hochul said she was considering employing the National Guard and out-of-state medical workers to fill staffing shortages. With 16% of the state's 450,000 hospital staff not fully vaccinated. Hey Siri, what's 16% of 450,000?
16% times 450,000 is 72,000.
That is 72,000. Healthcare workers who are fired for refusing to get vaccinated will not be eligible for unemployment. So what are they supposed to do?
So then they're going to lose their health care too.
So they lose their health care. They lose their money to pay their bills and rent. And so now you're going to turn 72,000 healthcare workers who are on the front line of treating COVID people for a year and a half. You're now going to kick them out on the street, literally.
They're not heroes?
They're not heroes anymore. This is sick. This is sick shit. Last year, New York's governor encouraged citizens to bang pots and pans out of their windows for healthcare workers. Now it invokes emergency powers to fire masses of them and intimidate the rest into submission in a tight job market. A few months ago, we were considered heroes. Today, they fire us because we are immune to the virus, SARS-CoV-2, but not to vaccines. I have treated more than 700 C-19 patients, COVID-19 patients, only 3 deaths. That is not learned overnight. Vaccines work, but natural immunity do better. There's a doctor telling you that. He's got better immunity than a vaccine, and he's going to get fired. Why? At the behest of Big Pharma. I can't think of any other reason that they would fire a guy who has natural immunity, better immunity than you get from the vaccine, and you're going to fire that guy who's a healthcare provider in the middle of a pandemic. Anything else you'd like to say about this particular story, Max?
Well, it's just consistent with the assault on workers that we've seen take place since the pandemic was declared. And whenever you hear people talk about the pandemic as if it's this active force, and they don't address actual policy choices made by politicians from both parties that on behalf of our feudal lords, which crushed workers. The lockdown policies, for example, saw something like 40% of people who were making under $40,000 pushed out of work. $2.3 billion globally were deprived of adequate food supply at a certain point. We saw 3 million women in the United States alone pushed out of work because they couldn't balance caregiving and mothering with their jobs. We've seen billionaires increase their wealth by 53%, particularly the billionaires in big tech who stand to gain the most from eliminating in-person learning and keeping people stuck at home, like Jeff Bezos. Actually, Amazon's stock went down somewhat when the lockdowns began to end. We've seen 200,000 small businesses close in the United States. Commercial real estate and small businesses getting scooped up by Larry Fink and BlackRock. All the wealth is going in one direction here. And it's not because of the pandemic. It's because of the choices that have been made by our ruling class in the name of public health. And what did the lockdowns do? Did they flatten the curve? No, they flattened the working class. And now these same politicians are continuing to flatten the working class, and with very little resistance from the organized left in the United States.
I haven't seen any resistance from the organized left.
No, I've seen cheerleading for it.
Yes.
Celebrations of people being thrown out of work.
Yes.
Joy, Schadenfreude at death.
And let's remember the point you brought up about how this, since this has started, has been an assault on workers, because what other countries did, if they closed your business down and said you couldn't go to work, they paid their salaries. So in places like Japan, they paid up to 100% of people's salaries. Other countries in the UK and Europe, 60, 70, 80% of people's salaries. Canada also gave people this. We didn't do that here. We just destroyed people's income. We destroyed their lives, and we never did anything back. We wouldn't give them a $2,000 check. They had to beg for $1,400. So they didn't do that in other countries, and now they're doing this here to these people. It seems crazy as other countries are opening up, by the way.
Norway declared an end to the pandemic this week and has classified COVID-19 as on the same level as the flu. Their vaccination rate, by the way, full vaccination rate is 65%. Fauci's trying to get the U.S. to 80%. Ezekiel Emanuel, who advises Biden on COVID policy, said that if we do not get to 80% soon, that all the unvaccinated should be put on a no-fly list and prevented from engaging in interstate travel. So that's what's happening here. It seems like our ruling masters just won't let a good crisis go to waste. And in Denmark, all emergency measures have been lifted, also with about a 65% vaccination rate. It seems like these countries are taking into account the entire spectrum of health factors of their population, and you see the celebrations break out in those countries as these measures are lifted, where here there's a feeling of intimidation, of foreboding, and of the population pitted against one another, the vaccinated versus the unvaccinated, with the unvaccinated being demonized as the new boogeymen of our era, the new terrorists, the new Russians, the new insurrectionists, whoever they are. They're all they're this fuzzy mass, and we can't really say who they are because they might not all be MAGA people. Some of them might actually be Black Americans and brown Americans, and we don't want to seem like racists, even as we call them stupid conspiracists. And they are becoming a social enemy. And for our ruling masters, well, it's another great way of tearing the working class, tearing people apart, pitting them against each other while they scoop up all the wealth and the benefits and increasingly securitize us with vaccine passports, which could ultimately be digitized, as we're seeing in Canada or Lithuania. And that's the introduction of a social credit system. So we need to look at where this is going, while other countries, which are more sovereign, actually take a different direction, move in a different direction.
So 70,000 people in New York, not 70,000 healthcare workers, not 70,000 people, 72,000 healthcare workers are unvaccinated in New York. That isn't in Oklahoma or Alabama. This isn't in your MAGA state. That's in New York. The healthcare workers. Those aren't just, and you know that 72% of young Black people in New York City unvaccinated. Again, those aren't MAGA supporters. Over 50% of Hispanics in New York City unvaccinated. Do you know who you're talking about? No, they take the establishment narrative from CNN that it's dumb redneck Trumpers, and right now it's 72,000 healthcare workers in New York State. that are going to get fired. So
I mean, yeah, we've never considered that the unvaccinated might be healthcare workers
Right.
and teachers and people of color, because the stereotype that's been created by the media, they've been trying to stimulate support among progressives and people on the left or among liberals who might have cared about civil liberties in another situation for just lashing out at their ideological foes. And so here we are. I mean, now you have a situation where some prominent Black Americans are beginning to speak up against this. And you saw what happened to Nicki Minaj a week or two ago.
yes.
She was essentially, I mean, it was a character assassination operation. And the reporters were sent to hound her family in Trinidad and Tobago. The fact is, when she was speaking up for bodily autonomy and making your own decisions, she's speaking up for people in the Caribbean region who feel that way. Many people might not feel that way, but she's clearly speaking for a constituency. She's speaking for a constituency that she knows. And her message resonated, and she was such a threat that the White House tried to rein her in. And now you see this happening in the NBA with Kyrie Irving, Jonathan Isaac on the Orlando Magic. And I was watching Chris Hayes last night on MSNBC, and it was a disgusting segment where Chris Hayes was painting these players as stupid and suggestible conspiracy theorists and claiming that they believe that the Moderna vaccine contains a microchip and that they don't want to get this microchip in them. And then he brings on an NBA player, but not a Black NBA player, to denounce these players, an NBA player from Turkey, Enes Kanter, who happens to belong to the Gulenist cult, to basically denounce these guys and call them stupid conspiracists. And then we see Jonathan Isaac of the Magic asked about why he's taking the position he's taking. And he sounds far more insightful and articulate than the CDC director, and far more humane. And he said, well, I've already been infected previously. I have natural immunity. I have stronger protection than the players who've been vaccinated. And we need to stop this insanity of claiming that I'm a threat to other players, particularly when the vaccine does not prevent infection in all cases and therefore does not prevent viral transmission. It's an individual choice. So you see, he's actually, you know, when you push people out with mandates, you're often pushing out the critical thinkers.
That's right.
You're pushing out the people that think for themselves. You're pushing out the people that care about their rights. And so in many ways, we could witness a kind of brain drain. With what was happening here is these people who are willing to take this stand, who won't be vaccinated and are willing to lose their jobs. Well, what else can you do to convince them? If this is to convince people to get vaccinated, what else can you do if they're willing to lose their jobs? Nothing. And so these people have been moved into the classification of surplus humanity, and they will be isolated from society under the guidelines of the new normal, particularly by vaccination passports. Their lives matter less. They have less constitutional rights. They've been classified as second-class citizens. We already had a caste system here. That's well known. But now we're seeing it be reinforced through these measures. And again, with either the full-throated support or the silent consent of much of the organized left in the United States.
Since we're talking about them now taking 72,000 healthcare workers in one state and firing them.
They have no safety net.
Listen to what Joe Biden said. I don't know when exactly this was from, but listen to what he said. This looks like with the hair and his mental acuity from like probably 94, 95. Here we go.
Don't get one disease under control, you may find legislative bodies taking whole classes of people based upon propensity of conduct. Well, to say, we're going to put you in a certain category. We're going to demand mandatory testing for you. Don't get...
So that, I'll play it one more time so everybody gets it, okay?
One disease under control, you may find legislative bodies taking whole classes of people based upon propensity of conduct. Well, to say, we're going to put you in a certain category. We're going to demand mandatory testing.
What does that sound like to you, Max?
Well, it sounds like he's warning about the kind of social credit system that's coming to the surface right now. It sounds like he's talking about our current reality and one that Joe Biden is enforcing after promising not to do it on the campaign trail. And, obviously he was much more aware of what was going on around him at the time. He's speaking very articulately there. He's not stuttering at all. We're seeing a different Joe Biden, and he's surrounded by technocrats and advancing their agenda. But, that was a chilling warning from, I guess, 94, 95.
And I
remember during the early days of the AIDS HIV crisis, calls to quarantine those who were infected and isolate them from society. And Reagan Surgeon General C. Everett Koop kind of stepped forward and emphasized their humanity and took that off the table. And you had ACT UP in the streets demonstrating against these kind of disgusting and discriminatory measures against people who were infected. So everything feels upside down right now. All the conspiracy theories I heard and back in March 2020 about passports and quarantine centers are starting to really come true. And if you're opposed to them now, you get called a conspiracy theorist.
So I just want to remind people that the people who said you couldn't do a vaccine mandate was Joe Biden, Nancy Pelosi, and Dr. Fauci. Last year in August and December, they all said you can't do vaccine mandates. Not like, well, we could, but we don't want to. They said you can't do it. Even if we wanted to, you can't do a vaccine mandate. That was Fauci, Pelosi, and this guy. That was just last year. And now they're firing 72,000 healthcare workers in New York State over a vaccine mandate. And by the way, Joe Biden said he wouldn't take the vaccine from Trump. He was hesitant. And so was Kamala Harris. They were hesitant. And so Andrew Cuomo said he didn't trust the process of the vaccine and he didn't trust the FDA. That was the governor of New York just last year saying he didn't trust the FDA, the vaccine process, or the president of the United States. And now the governor of New York is firing 72,000 people who don't fully participate in that process. That's what's happening right now. Let's remember, Trump was the one who developed the goddamn vaccine. He did it at Project Warp Speed, and he took the vaccine. And when he goes out at his rallies, he tells everybody to take the vaccine. So again, the establishment wants to build this up as a red state, blue state thing. But there's 72,000 people about to get fired, healthcare workers in New York, and you think that's good healthcare policy? It is not. That is a corruption of our healthcare policy by Big Pharma. Here's Joe Biden last December. Someone asked him, "Are you going to mandate vaccines?" And he says,
"No, I don't think it should be mandatory. I wouldn't demand to be mandatory, but I would do everything in my power. Just like I don't think masks have to be made mandatory nationwide."
So he was against mandates for vaccines and masks. This is December. Here's Nancy Pelosi.
So here's the thing. We cannot require someone to be vaccinated. That's just not what we can do.
Not we shouldn't do it, but we can. We cannot do it. That's the third most powerful person in the country.
It is a matter of privacy to know who is or who isn't.
We can't do it. Here's Dr. Fauci. Fauci said everyone has the right to refuse a vaccine. Fauci said everyone has a right to refuse a vaccine. But now you're some kind of crazy redneck if you think that. Fauci said if someone refuses the vaccine in the general public, then there's nothing you can do about that. You cannot force someone to take a vaccine. That's Fauci, August 2020. Now everything's changed. They're corrupt. They're all corrupt, and they're lying to you. And these vaccine mandates are not about health. It's not about health. Go ahead, Max.
It's really confusing when you consider where this is going, because they want to get to some kind of herd immunity or some kind of threshold of vaccination, upwards of 80%. But then when you look at Harvard Business School and what just took place there, where the school is 100% vaccinated and has mask mandates, and they have just gone to remote learning. They've ended in-person learning for the time being because of an outbreak of COVID cases. And you've seen new restrictions on other campuses.
Duke University, same thing. Duke University, they had like 99% vaccination rate. They had an outbreak. Go ahead.
Yep. 380 cases. Over 90% of them were in the fully vaccinated, because you're talking about cases in the PCR test. And I'm not going to argue with people who say that, the vaccines prevent, help limit death in many groups. I'm not sure if, young people who are completely healthy would necessarily die from COVID, but, they've gone and taken it and they're still having cases. And on a population level, the vaccine is not preventing cases, many of which are just like asymptomatic or mild infections where they get, the sniffles or they cough for a few days. There aren't that many hospitalizations, but the ruling class of our country, which shifts in and out of, university positions, either as faculty or directors of the university. You look at like Judith Rodin, for example, former University of Pennsylvania dean. Now she's the head of the Rockefeller Foundation, which is guiding a lot of the so-called science right now. They've determined that classes have to be shut down simply whenever there are cases, which means that this could just go on indefinitely. If we are going to let these people set the agenda and we're not going to live with this on some level and incorporate the public health measures that have actually worked.
We're doing a live Jimmy Dore show in Sacramento, October 3rd. We just added a second show. Plus, we're doing stand-up comedy in Florida, in West Palm Beach and Dania. And then we're going to Buffalo, Baltimore, Tempe, and Portland. Go to jimmydoorecomedy.com for a link for all our tickets.